Okay, so I do want to ask now about the treatment. So the treatment part of it, of course, very standard for Hodgkin's, for lymphoma is chemo.
Mhm.
So, but this was the chemo that they prescribed was AVD, so no B. Usually, we hear about the bleomycin. So
Yeah.
actually, before we get into that, when you met your oncologist, how was that, and how did he or she describe the treatment to you?
Um, so, like I said, I had a oncologist before. It wasn't really too much communications on that part. Like, they explained. I kind of like once I was in the chemo room. That's when I kind of really asked, like, what is this? Like, what? Um, when you hear kind of like explain more, like, okay, what is this? What are you putting in me? What treatment is this? And if anybody knows, like, you going through chemo, the only one I bigly, like, I really remember is the red kind. I don't know if you received that one, the red devil, whatever they call it. The strong one, that's the one I remember the most. And that brought me to researching, like, okay, what are they putting in me? Because when you go through a process, like, all you just want to do whatever it takes to get better. Like, just give me whatever. Just to know that I'm gonna be okay. And now I kind of regret that. I wish I just took the time, not regret, but I wish I would have took the time to research more and ask more questions. Like, what is this?
You were caught up, of course, in such an overwhelming time. So later you can ask, like, oh, I wish I had asked this and that, but you were just going with it as best you could. So I think you were doing an amazing job. The Red Devil, yes, and I know. So Adriamycin is one that people call the Red Devil, and it can get kind of weird because when you go pee, and then your
Yeah.
urine is kind of like
I
red.
wasn't gonna say that, but yes, that's the first thing that comes out is that red. And the process during it, it was so nerve-wracking because you would use the bathroom before, and then it's like, and it just didn't matter how many times you used the bathroom before, I always had to urinate during the process. So that was nerve wracking because I'm like, oh, I dread it. I dread it because you have to know, like, there's other people that's getting treatment in the room and they using the same bathroom. And one of the things is your sense of smell is so strong. So if anyone out there know what I'm talking about, like, you smell everything, other people's like treatment, everything. For me, that was my personal experience.
And you know what? We're going to spend a lot of time talking about the side effects of chemo right now, actually. But before we go there, I would like to know so you were given AVD, is that right? Um, and Adcetris already, that was in combination with the AVD?
Yes.
Okay.
So and then plus of course the steroids. I think I got Zofran, and then did I get I think I gave they gave me Benadryl. I'm not sure. I can't remember.
Okay. But the Zofran, of course, is for anti-nausea, and the Benadryl is for any allergic reaction
Hmm.
you might have. So you did 6 cycles. Can you describe to people what that was? So it'd be, is it one day of infusions, and it's every cycle is 3 weeks? Is that right?
For me it was every two
Every
weeks.
2 weeks. Okay.
Hmm. So usually that was when I first started out, it was on Fridays, so every other Friday, and then once I changed doctors, it was every other Monday. Yeah,
And
and I'm sorry, that was like about 3.5 hours of
Okay.
treatment time.
And it's not just chemo infusions, right? You do have to go early and get blood work done at some point. Can you describe that?
So, my first, um, for my first doctor, we did, you always had to give urine tests, pregnancy tests. For the first doctor I went to, I always had to do pregnancy tests before I could receive, which is, and then later on when I moved to the other doctors, I had to get blood work. So I always had to get blood work before each treatment, and I always saw the doctor. So I always saw my doctor before the treatment.
And of course, that's to make sure that your blood levels are okay, the counts are okay, to be able to
Mhm.
take the chemo, and then your doctor's going to want to check in. And by the way, we're not going to go into it, but I just want people to know, because you say switching doctors, it wasn't really anything except the first hospital had some hurricane damage, right? And so you had to move to a different one.
I'm glad. I'm sorry. It was a blessing in disguise. I don't want people to think that, oh, like, oh, they got damaged. And I'm sorry they got damaged, but it was actually a blessing in disguise because I moved to a better doctor in a bigger area. And they had a better treatment, like just a whole better experience for me. Things that I weren't used to that were small,
like
like heated
what?
blankets, like huge things that you'd be like, okay. I didn't have heated blankets at the other one. I didn't have snacks and drinks and all that kind of stuff. Like it's so much better here.
For people who don't understand, the importance of having those small things, the heated blankets, the snacks, the water, even just sort of the environment, can you try and describe why it's so important to a patient to have these things?
You want to feel comfortable um through the process because it's a long, you're sitting there for hours. Some might go shorter, but that's hours you having like the experience of something running through you. And something like running through you and going through you. And I don't know, it for me, it felt it's very uncomfortable. Um, makes you feel kind of icky because you can smell the chemicals. They make you being comfortable like as much as possible. Sometimes the medicines they give you can make you sleepy, but also the best sleep you will receive because no one talks about the sleep disturbance sometimes at night. So you get your good sleep during the chemo. So just being comfortable and make sure you have the snacks and drinks and whatever makes you feel like you're, you know, just not alone. Like the nurses are just like caring and attentive. Like I know I had nurses like, you good? Do you want something, a snack? Do you want a drink? Those are little things that matter because it makes you not dread going to the hospital.
100%. And nurses, shout out to them because they're such a lifeline in there, where, we were getting treatment. I remember I had such great nurses too. But you're highlighting the human part of the experience. The medical part, we can't really control much of, in terms of the medical treatment. Once we say we're going to do it, we just kind of go through it. But
Mhm.
the human part, the quality of life, feeling like as comfortable as possible, these are the really invaluable parts of the experience that I'm so glad you're highlighting. And you had also mentioned, Delishea, the doctor. You like the doctor more. What was it about the doctor? What are the differences? What makes a good doctor versus a not as great doctor?
Um, oh, so the my oncologist and my radiology doctors here were wonderful. Like the huge difference is you feel like making it feel like they care, explaining things to you, um, like breaking it down, like making you feel like your questions aren't dumb, like like not making you feel like, okay, this is a dumb question. Like, they explain, like even the smallest things or things that you think are stupid or just common sense questions, they stop and explain, they care. They ask things about you as a person, like, how are you doing? I know my doctor here was very attentive. He asked how things were back at home. He knew what I went through each visit. So that's a huge thing.
Thank you for sharing that. We'll make sure that, hopefully other people are able to see this and maybe learn a thing or two from the patient experience. So I'm going to pop up the picture again. I know we'll get into this later. You ended up having to get your port in your thigh just because the one in your chest didn't work so well. So we'll again talk about that in the next sort of section of the story. But I'm going to pop up this picture. It's a candid photo that your sister took of you in chemo. And I would love for you to talk more about the side effects that you're feeling. What were you feeling? What were the side effects? When did they hit you and how long they lasted? And also what helped you get through them?
Oh, yeah, like I said before, sometimes you get the best sleep during the chemo. So I was very tired during it, but afterwards that's when I get my first meal. So before I can feel any of the effects, the nausea or anything kick in later, I would get like a nice sit down dinner. We would sit down and eat dinner and make sure I have something full in me because steroids makes you one of the side effects and one of the things that give you is steroids. And steroids had a huge effect on me. Um, One of the side effects for me personally was weight gain, fatigue, and my appetite kicking in. I crave carbs and sweets and everything bad, which is frustrating because they tell you the opposite. You have to eat healthy, watch what you eat, but it makes you crave the worst things. So that was one of the things for me. Um, a little bit of I another side effects I had was like joint pain um for my back maybe. So um just because you're not moving as much as you usually do, because you're more I know I you're sleeping more, you're laying down more. So that was a thing for me. Um and neuropathy, I don't know if I'm saying it right. That's something I'm still dealing with today. Just a lot of other things. Hair loss, of course. Um, that's about it. All the initial, like the scratching, like the itching, that went away after the first treatment. The fluid on my lungs went away. So it's like I needed the treatment, like all that went away.
So did you experience nausea at all or any constipation or any of those side effects?
So I didn't have problems with the constipation, but the nausea, I had a little bit of that, but it's kind of a weird feeling. It's like if I didn't eat, the nausea made me want to eat more. I don't know how to explain it. If I didn't eat, if I ate too little, I got nausea. If I ate too much, I got nauseated. So it's like I had to eat something or I just felt like very weak, kind of weak feeling that come over me. I did mention they also the same day they gave me I forget the name of it. I don't know if you ever heard of it. It's the shot they put in your arm.
You're talking
Um,
about Neupogen?
yes. And probably should have mentioned that before. I don't know. I totally forgot. Um, that's another side effect that has side effects too. That itself has side effects. And then so basically that can cause constipation, stomach ache, but I didn't experience none of that. I try to stay hydrated so none of that would happen. Like, because they say a lot of these medicines cause like that can cause problems with your kidneys and all that. And I was kind of scared of that. So I made sure I was hydrated and all that kind of stuff. And just make sure that I was flushing it out.
It's great
Especially
advice.
days after chemo, I would drink water and make sure I was just flushing out all the chemicals and everything that I needed to.
So hydrate, flush out, just try to move everything through the system as quickly as possible. That's
Yes.
wonderful. Speaking sort of that, and you had mentioned feeling weak earlier. I know you said in the mornings breakfast was super important. That's a picture of one of those. It looks delicious. You have fruit, you have toast and eggs and other things with juice. It was because of some of the side effects, right? You were feeling weak and you needed to get that
Right.
first meal.
Yeah, that's not a typical breakfast. That's not something that I would eat on a regular. Like, sometimes I would skip breakfast. Like before that, like all this happened before the medicine, I wouldn't eat breakfast. So that's a huge breakfast, having grits and eggs and toast and fruit, a smoothie drink. Yeah, it was. I used to eat huge breakfasts, but I always made sure that it was something that had protein in it, like eggs, and I made sure that I got fruit and veggies.
Right. Wonderful. A very complete sort of meal for you. You also just mentioned hair loss, which of course is a huge deal for people. So I wanted to ask you about your experience with the hair loss and how you dealt with it.
So for me, um, I don't know, like it wasn't. I hear some people like say that it was very emotional, and I don't think it was no emotional for me personally, but I just didn't want to see my family see it fall. Like I wanted to protect them from seeing that part of, but they initially saw it anyways. I know I had my hair in little twist locks, and I don't know if I have a picture of that, but I don't know if it was holding, the locks were holding my hair in. So it was time for me to wash my hair, and I, undid my hair, wet it and undid my hair, but then my hair kept tangling like knotting. So my mom kept asking me, "Do you want me to do your hair? Do you want me to do your hair for you?" And I was like, "No." I'm like, "No," because I wanted to protect her from seeing that because that's your mom, and I know my mom. And then she did my hair, and then finally it was just it pulled from my roots. It was just pulling. And then I was like, she was like, she stopped and she was like, D, you're gonna have to go ahead and shave it all off. And see, my brother, I'm lucky that my brother is he's a barber. So he knew how to cut hair. So I really didn't want him to do it. I wanted him to do it at the shop where when nobody was there and protect my family from seeing it and everybody, but I needed it done then because my hair was falling and I didn't want to see it on my pillows or wake up to it or anything like that. So he shaved it all off, and then it wasn't too bad for me because my hair actually started growing back before treatment even ended. So I was very blessed, and I asked my doctor about it, And I was like, is it normal to see your hair grow back before treatment? He said, yeah, a little peach fuzz you'll get. I hear patients get. And then me and my sister look at each other and I was like, I have a little bit more than a peach fuzz. As you see from the picture, that's more than peach fuzz.
That is. That is
So
interesting.
it started going back like before. So I wasn't too attached. But I can say now presently, if I did lose it again from just the treatment I'm on now, then I think I would cry. Yeah, I would be emotional about it because it's like I've seen it grow back and all that.
It's the process of you lost it, you were able to deal with it, it grew back, but then having to deal with it all over again, you think that'd be a little too much, right?
Yeah, because it's a possibility it can fall out
I
from what I'm doing now.
I see. And you know, for you, I know it's not just chemo that you went through. By the way, did you got a scan, you know, in between the chemo treatments, and you had the 6 cycles? How was that PET scan?
Um, so each one of my scans were showing they were good scans, they were good results, but like I said earlier in my story, in the conversation that I went through the storm, a hurricane, and that period actually affected me. So that's to this day, this is why I'm on Adcetris and I have to do it because that long period of time kind of delayed. But each one of my PET scans were pretty good. They showed like the chemo was working, everything was working. Kept shrinking. I don't know the exact size though.
Right. But so it was trending in the right direction, but it wasn't completely taken care of by chemo. Um, and by the way, you're referencing, of course, the hurricane that happened near where you lived had to displace you to the other hospital. So that was a delay in treatment of a
Mhm.
few weeks, is what you're talking about, right? I'm so sorry you had to deal with that. Your oncologist, when he or she told you about the treatment, the chemo, did they say you would also get radiation, or was that something after the PET scans where they said, okay, we're going to need to do radiation as well?
It was discussed before um, the last PET scan. It was discussed. It wasn't concrete yet. He wanted to kind of see. Um, but then after the last PET scan, he was like, yeah, so we are going to do radiation. And then that's when he sent me to the radiation doctor. Um, and we went from there.
Can you describe, I know that it was, gosh, just shifting from one treatment, you're done with chemo, but you're not done, and then you're having to
Mhm.
go through radiation. First of all, how many radiation sessions did you have? And describe sort of what it was like for you.
Um, so it was, so I had 4 weeks. I had to do 4 weeks in 20 sessions. So that was 5 days a week. So you do straight days a week. Um, and I got 35 grade. That's how much they said I get. So it's not a lot compared to other cancers and targeted radiation. Um, the process was fairly easy. So they mold you, which was fun, seeing my mold. Um, they
What are
mold,
they, what are they,
mold
oh yeah.
they make a mold of you and then from there they adjust. So any adjustments they have to make, they will make. And that's what you laid in each day. And you have to line up to those measurements each day so they can get the targeted spot that they need for radiation, to radiate the areas they need to. So
And
you have in those measurements. That was a big thing.
those had to be precise. And when you say mold, so they were just molding a section of wherever they were targeting the radiation. So for you, it was your sort of chest area.
So no, like when I say mold, I was like a laid in cushion. So kind of think of like Play-Doh, and you have to lay in, you laid in Play-Doh, and they laid the back of me to kind of relax in. And that's what I laid into. So for me, because they were targeting my chest, that's where they had to, my chest had to be open. So that all had to be bare. But other than that, they made it really comfortable. You listen to music, whatever music you want to listen to that day, that was it. It was very comfortable. You just let them do their thing. You really don't have to do anything. They move you. They tell you, don't move with me, we move you. So it was just, you just came in and lay down and listen to music, really.
You make it sound like such a breeze. And how long each session was not very long?
Short. So it was about 10 minutes. Depending on what makes it longer is if they have to adjust you with your measurements, they might have to move you around to get that right area, because they have to make sure it's right before the radiation, the computer starts.
And it's about 10 minutes for the actual session, basically. But then, of course, there's time to check in and undress and do all these things, right? So overall, you spent what, like an hour there, maybe, or?
Um, it was about no, it was about 15 minutes.
Wow, very quick.
So you go in. Um, for me, since they were doing this area, I just I left my pants on. They already have gowns in your dressing room. They tell you to go in, you put your gown on, and then you go straight to the room, and they already got your music that you selected to play, already playing, your mode already down, and you just have to lay down, and then they're gonna adjust you. If you're not laid right, they'll adjust you. So you don't have to do anything. You just come in, and that's what helps is your nurses and the doctors, the people that tend to you when they're doing their job correctly and make you feel comfortable where you don't dread, because you're going 5 days a week. I had a wonderful team, and I didn't dread going. Like, I really enjoyed them.
Did you feel any side effects?
Mm-mm. So, oh wait, no, I'm sorry. I did. Not during the process, but my side effects came after treatment. So anytime you have your esophagus or anything like that is in the way, which mine was in the way of the treatment, it's kind of it's like a burn. Like, kind of the best thing they said, the best way to explain is like getting a sunburn inside, and it's not a great feeling because you can't drink, you can't eat, it hurts. It's like a kind of like a cat then clawed inside your throat.
Ouch.
Is the best way. They can't really do anything to do it. All they can do is make you comfortable. So aloe vera juice, they call it like a little miracle mouthwash mix. And you can take that. But other than that, it's just, you can't really do nothing. You can't really eat. I couldn't really eat anything. It was dreadful.
How long did it take for the sunburn feeling to go away?
For me, it was about a week.
Okay.
Mm-hmm.
So just time was the only thing that really helped you, was waiting for it to just subside.
Time and healing and just being patient, but it's very horrible because you can't eat. You can't really drink like you want to. Water even hurts to drink. So.
And you were just talking about your team. So I'm going to pull up a picture from your last radiation or the session after. Describe, what it meant for you to be able to finish radiation and to have the support around you.
So it was kind of like that last day that you're seeing was such a wonderful day, because they took the time out to made you feel special kind of like it was your birthday or something because yeah, it was a good day. The team was wonderful. They were caring and um what was the question again?
Yeah, just what it felt like to finish radiation,
Oh,
and to have the great team around you. Yeah.
yeah, it was a really overall good experience and good feeling. Um they made me feel like when you go through that young at 30, um, or you're the youngest person in the room. To this day, I still haven't seen anybody young, which I guess is a good thing. But and so when your team is like, trying to be like they like saying, I know a lot of times when I went in there, they were, oh, we're so glad you're in here. You have the good music. Because all the other people like to listen to oldies and disco and all just kind of, they was like, we're so glad you're here.
It's
Because
amazing.
they wanted to dance and listen to like newer stuff. And
And that's what
it's
you brought with.
like,
Yeah, I love that. Um, it's such joy coming from you right now and seeing that in the photo. So thank you. I know that you're still now on treatment. In fact, you started your first treatment of Adcetris, a targeted therapy. It's still an infusion, right? You started it about a month ago, so April of 2021. Can you describe what it is and how it's been?
it's called Adcetris. It's a targeted therapy. It's given through infusion. So it's given through your port and it's supposed to, when you get chemo kills all cells, like but this just kills like the cancer cells, I guess if I'm explaining it right. Forgive me if I'm not. Um, it just kills all the bad cancer cells. So it it doesn't really have any side effects so far that I've noticed. Maybe just the neuropathy on my fingers and my feet and all that kind of stuff. It's a possibility of fatigue and hair loss and all that. The same as chemo, but so far I haven't experienced any other thing. And I get it every 3 weeks. So every 3 weeks for 30 minutes. And that should be to up to 6 months to a year. So I don't know if it's going to be to the end of the year or not.
Great. So, yeah, it's great to hear that you don't have side effects. And yeah, I know we will leave the medical explanations, but we do, to the doctors, but we do know it's a targeted therapy and it targets a particular protein, CD30, which helps to stop or slow the growth of cancer cells. So it's great to hear. Part of maybe how targeted it is what's helping with the side effects, that you don't feel as many or any at all, I guess is what I'm hearing from you.
Yeah.
So any last thing you want to say about, what's the latest, I guess, scan? I know you have one coming up in next month, but how do you feel, and is your doctor happy with the progress so far?
So my progress has been going pretty well. I know from the last from the PET scan I've had at the beginning of the year, from the end of the radiation, I had a CT scan. So from there, my tumor has shrunk just from the radiation. So I have one coming up in June, and we'll see if so far if it'll shrink still, or he really wants to get it to a point where it's steady. So it's not growing, there's no activity, nothing to where they can just monitor me. So I can get those, I won't have to come in and, every 3 weeks, like get the Adcetris, like, get scans like regular people, like cancer patients, do that same remission and get it every 3 months to 6 months to the year. So they just want to get me to the point where they can fully say that they treat it, because the cancer, like they said, this cancer is treatable. And they just want to make sure they do whatever possible they can before they, let me go. Let me go a little bit.
Yes, of course. They want to get you to no evidence of disease. And then you can do the regular protocol. And yeah, like you said, every 3 months. And then after a couple of years, it goes to every 6 months. So yeah, that's the goal for sure.